Hey guys, Lauren Vandermast here from laurenvandermast.com, elite performance coach. I help athletes and sports people realize their full potential through coaching and specialized exercise programs. So I'm just going to share with you a question that one of my clients asked me this week and my answer. So my client asked me because her dad has some health stuff going on, and I know she wants to help him, but she also knows that he's probably not going to listen, and if he does listen, it needs to be like super baby steps. So her question was, will pelvic floor exercises help with my dad's lower back pain? And I said yes, but will they be the number one thing that helps the most? Uncertain. So what her dad does for work is he sits down, he's working, he doesn't just sit. He sits at a desk for 4 hours, and then he has 4 hours where he's out in the field on his feet. Now, what happens when we sit, especially, well, actually not just sitting, but if we do some kind of body position for long amounts of time, it kind of falls into the overuse category, and our body will adapt and change shape to make it easier. So when we sit, that's what happens for long periods of time. Our body will adapt, change shape to make sitting easier, like it needed to be easier. So the problem with that is that when we stand back up, we're not actually returning to a proper posture and standing. Components of how our body is changed shape are going to stick. Usually that ends up with the pelvis tilting forward, or it's usually got to do with something to do with the pelvis. So what I think is going on with her dad is that he's standing up, his hip flexors are too tight, it's pulled his pelvis forward, which probably is going to, it's probably the wrong way to say it, but switch off his pelvic floor and his glutes and put the work into his hip flexors, and his lower back's probably sore because his core's not doing his job now, and his lower back is doing all the work instead, and that's why it's sore. So doing a pelvic floor exercise, sure, that'd be great for this, but is it going to be the number one thing that's going to help him the most? I mean, look, if you're listening to this and you've got lower back pain, do all of these things, but I was just trying to put this question, or answer this question the way I answered it to her, because she was just looking for one thing to start him on. I would say for him, what he needs to do, well, actually to go back to that. So he's sitting all day, his body's changed shape, right? So he's out of alignment, and then he goes and walks for 4 hours with his body out of alignment, and then his lower back's probably doing way too much work, and that's why it's in pain. So yeah, what I was saying was doing a pelvic floor and a core exercise, sure, that'll help retrain the body to put it back where the stabilizing work back where it should be, and reduce it in his lower back, but that's not going to help relax his hip flexors and correct his pelvis position. What I'd be suggesting as a number one thing to do would be stretch the hip flexors. Now, there's sort of two hip stretches I think most people are aware of. This one you'll be kneeling with one foot in front, but I don't want you to go all the way forward and down where you get your hands on the floor. The one you want to do, I know this doesn't make sense so much because I'm explaining it, is you want to stay upright through your torso and actually tuck your tailbone under to really push into that hip and hold your stretch there. If you really want to know what this stretch is, I know I've done a video on it. It is somewhere under here on my Facebook page, so go for a scroll. It's there. I know it's there. Hip flexor stretch, that'll help correct the pelvis position. Then the pelvic floor exercises will work even more effectively because now your body's in the right position, so that'll help release the lower back, put the work back into the pelvic floor. A little bit hard for me to explain through this quick video, but the other thing he'd be wanting to do is correct his posture, which is a little bit more thought work than anything. It's just understanding where your body needs to be in space and trying to stick to that where possible. And then you'd want to be restabilizing through the glutes and having them fire and do their job properly. Please do not hear that as strengthen your glutes and go and do 100,000 pop your booty exercises, because they're completely not the same, and you're probably overusing your lower back in them and not your glutes anyway. That's another story. So there you go. If you have lower back pain or know someone who does, yes, pelvic floor exercises, but definitely get those hip flexor stretches in there. And if you want to know more about realigning your posture and getting your glutes to fire, might as well. It's good for your health, help reduce pain. Why not? Send me a private message. It's in my upcoming Athlete Academy course. Anyway, guys, thanks for watching, and I'll see you all again really soon.